We hear it all the time. Technology is going to solve the world's biggest problems, that if we just have the right app, the right data, we can fix anything. But what happens when you take a brand new digital health tool and drop it into one of the most challenging, conflict-ridden places on the entire planet? Well, today we're digging into the story of an app that really did go to war. It's a digital health story from Afghanistan, and it holds some incredible lessons about the promise and the real-world perils of technology. Let's just start with one number, 638. Now, this isn't just some random statistic. In Afghanistan, that's the number of mothers who die for every 100,000 babies born. That number alone sets the life or death stakes for the story we're about to get into. It shows you just how urgent the need for a solution really was. And that number? It's really just the tip of the iceberg. It's part of a much, much bigger crisis of care, this huge public health challenge that a lot of very smart people were desperately trying to solve. When you look at the details, you can see the crisis just goes so much deeper. On top of the maternal mortality rate, you've got these staggering numbers for infant and child deaths, and then, making everything worse, there's a critical shortage of qualified health workers, especially out in the remote rural areas. This was the reality on the ground. So, right into the middle of this crisis comes a potential solution, a digital lifeline, you could call it. This is where we meet the Sehatmandi app, a modern tool that was designed to bring some order, some data, and some accountability to a system that was really struggling. So, what exactly was this app? Well, Sehatmandi, which means well-being in Dari, was this tablet-based tool that got rolled out across 189 health facilities in these really remote provinces. And its main job was pretty straightforward, but also incredibly powerful: to digitize how they tracked performance, all with the goal of making the whole health system stronger. Okay, so what did it actually do? It had a few key functions. It could track performance in real time against 11 key health goals, things like immunizations or prenatal care visits. It would automatically turn all that data into these simple, easy-to-read dashboards. And this part is absolutely critical. It allowed for offline data entry, a total must-have for clinics with spotty or non-existent internet. And here's what that looked like in the real world. A health manager could pull up a dashboard just like this and see in a single glance how their clinic was doing. Are they hitting their targets for deliveries? Are immunizations falling behind? This kind of visual data let them spot problems fast and make decisions based on actual evidence, not just guesswork. And you know what? At first, it was working. It was really working. Out there on the front lines, the app was genuinely empowering healthcare workers and completely changing how they did their jobs. What's so amazing here is that the app created visibility. Just listen to this quote from a facility manager. "When we collected and recorded data in Sehatmandi, our performance was evident." Think about that. For the very first time, all their hard work was right there, clear and measurable. That created a whole new level of motivation and accountability. And again, that offline feature was just a total game changer. As another manager put it, they could enter data anywhere, anytime, and just sync it up later whenever they found a signal. In a country with huge mountains and disconnected communities, this wasn't just a nice to have, it was an absolute necessity. So when you put all these features together, the result was a system that was just faster, smarter, and way more accountable. Reports that used to take weeks to put together on paper were suddenly available on time. Meetings were no longer about guessing, they were focused on real data, letting people figure out why a target was missed and what they needed to do to fix it. It all sounds like a massive success story, right? A perfect example of technology solving a really tough problem. But here comes the twist. In a place as fragile as Afghanistan, could any of this truly last? Because, of course, the app didn't exist in a lab. It had to survive out in the real world. And that meant confronting some enormous hurdles that stood in the way of any long-term success. This slide just lays it out so clearly, the stark difference between the promise of the app and the reality on the ground. The promise was real-time data. The reality was weak internet and constant power outages. The promise was a team of trained staff. The reality was super high employee turnover. The project was built on the idea of stable funding, but it ran headfirst into political instability and massive budget cuts. This quote from one of the project directors really gets to the human side of the challenge. Your tech is only as good as the people who are consistently trained to use it. When you have high turnover, you're just stuck in this exhausting loop of retraining, and the real work gets pushed back. And this timeline shows you how it all came to a breaking point. The app launches in 2019, shows all this incredible promise, But then, in August 2021, the entire political landscape of Afghanistan is turned upside down. International funding gets suspended, and the whole Sehatmandi project just grinds to a halt. Its future and the health of the people it was built to serve suddenly thrown into complete uncertainty. It's a really sobering story, but I don't think it's a story of failure. It's a story that is just packed with powerful lessons. Lessons for anyone trying to use technology in the world's most difficult places. It really forces you to think about what it actually takes to make these projects stick. So, what's the blueprint we can take away from this? Honestly, these aren't just lessons from one project. They're universal rules for any kind of tech for good project in a fragile place. First, you have to build the foundation: reliable internet, power, durable devices. You have to start there. Second, invest in people with nonstop training and support. Third, integrate your tools into the systems that are already there, so you're not just creating more work. And finally, you have to secure long-term funding that can survive political storms. And that really brings us to the biggest takeaway of all. Technology is an incredibly powerful tool, for sure, but it is not a magic bullet. You can't just parachute an app into a crisis and expect it to work miracles. It has to be designed, implemented, and supported for the messy, complicated, and unpredictable world it's actually going to live in. Which leaves us with this final, crucial question. It's not about if technology can help. We know it can. The real challenge, the one this story forces us all to face, is this. How do we build technology that doesn't just work on a PowerPoint slide, but that actually survives reality?